Once again, A1C, high blood sugar as it relates to diabetes. Welcome to my channel. Today we're going to talk about how you can possibly notice that there might be something wrong with regards to your blood sugar being too high. It's not that difficult. High blood sugar. Learn to control your pre-diabetes and lower your A1C. What we're going to talk about today is these are conditions that happen to me. We're going to scroll down here a little bit. But your blood sugar is too high if you experience fatigue, which is something I did, increased thirst, which I did experience, dry mouth, which is something you notice really at night, especially before you go to bed, and frequent urination. And I really had a problem with the frequent urination. I could barely get a decent night's sleep because I was going to the restroom all the time, almost every 2 or 3 hours. Almost every 2 hours, really. Fatigue, you're just tired all the time. You just want to take a nap. Every time you sit down, you fall asleep, or you want to sleep all the time. The reason being is because you're eating, but your body's not converting the food that you eat into energy because you're not producing enough insulin. Your pancreas is just not working well enough to produce enough insulin to convert all of those carbohydrates and all that sugar in your blood into energy for your body. So you're going to be tired. Increased thirst. You're going to be thirsty all the time. Every time I turn around, I was stopping at Circle K or Quick Trip or someplace, buying a diet drink. Back then I was drinking diet drinks. And I just was drinking 32 ounces all day long. And as you know, you're drinking 32-ounce drinks, tea or diet sodas or whatever, and you're urinating all the time. Every other hour, every 2 hours, you have to stop and go to the bathroom. You can't drive anywhere because every time you go someplace, you're thinking about where you're going to stop so that you can go urinate. I mean, it's just insane. These are markers. These are heads up. Hey, I've got too much sugar in my blood. So if you're experiencing fatigue, increased thirst, dry mouth, frequent urination, go see a primary care physician. Get a referral to see a certified diabetes educator and check your A1C, find out where your blood sugar is, and get your A1C, get your blood sugar under control. We're also going to talk a little bit here about some other conditions that you won't see in the pictures. Blindness is a big one. Basically, your optic nerves go if you've got too much sugar in your blood. Too much sugar in your blood puts a tremendous amount of stress on your kidneys, and you end up with kidney failure. I just lost a very good friend to kidney failure related to diabetes. The last time her and I talked, she had told me that her primary care physician was going to get her scheduled to go on dialysis, but then about 5 days later she passed away. And I got a call from her granddaughter telling me that her grandmother passed away, and she primarily passed away from kidney failure, and every last bit of that was related to diabetes, super high blood sugar. She really struggled with trying to change her diet, and she was way overweight, probably close to 325 pounds. So remember, blindness, kidney failure, cardiac arrest. If you've got too much sugar in your blood, you're looking at these, it's like looking down the barrel of a gun. And these are quality of life changing events. If you have to go on dialysis, that's going to change your life significantly. If you go blind, if you have a heart attack, all of these things are going to have a significant impact on the quality of your life. Look at some of these pictures here, these dark spots around this hand in the center picture. That's because of lack of blood circulation. created by too much sugar in the blood and what's something called neuropathy, which basically you just end up, these fingers, these three especially, are probably going to be amputated. If you look over here to the left, this individual is on dialysis. This is what dialysis looks like, and you've got to do this. I think it's three times a week, 6, 7, 8 hours a day. Someone's got to take you, and somebody's got to pick you up. And it's very hard to hold down a job if you're on dialysis, because dialysis is physically demanding, and people that are on dialysis are tired all the time. It's a tremendous effort that you put into trying to stay alive by just going to dialysis. This picture over here to the right of the foot, this is the skin thickening on top of the toes, darkening. Once again, a reduction in circulation in the outer extremities, especially in the feet. And eventually that will get worse, and it could graduate to this condition right here, right below, where this individual developed neuropathy. He probably stepped on something walking outside barefoot, punctured both his feet, didn't realize it. With neuropathy, you basically have lost a significant amount of blood circulation in your feet, and so the punctures don't heal, and eventually they get infected, and the next thing you know, you have gangrene, and then they have to amputate your foot. In this case, this gentleman probably had both feet amputated. And you can see right here, the picture in the center, where this individual lost the lower part of his left leg because of diabetes. Also, I see people with this condition quite a bit on their hands. I might bring it up to them and say, hey, how's your blood sugar? They'll say to me that their dermatologist says it's psoriasis, and they don't get their blood sugar checked. I've seen this condition on people's hands, on both the palm and the outside of their hands, on top of their hands, and I've seen this condition all the way up their arms and all over their legs. And they need to get their blood sugar checked. If you are experiencing this dry skin, thickening skin on top of your hands, on your arms, on your elbows, on your legs, go get your blood sugar checked. Go get an A1C test. Ask your primary caregiver to give you an A1C test, or go get your blood drawn at one of these blood testing facilities and get your A1C checked. This situation right here in the center with this foot, once again, this hole in his foot will not heal. Lack of circulation. You see how dark the skin is at the bottom of his foot. This is another amputation. This picture here with the heart, once again, if you have too much sugar in your blood, you're going to put your heart under a tremendous amount of stress. And if that happens, you're going to have a difficult time. And eventually, your heart will just stop. This situation right here with the legs swelling up, this is the darkening of the skin. All of this is neuropathy, diabetes, real trouble here. Probably going to eventually end up with both legs amputated. The swelling of the feet is an additional medical condition that we'll talk about later. But a lot of this is predicated because of diabetes, uncontrolled high blood sugar, and the elimination of blood circulation in the lower extremities. Both these legs will probably be amputated. The pictures in the center here, this is dry skin. The skin is thickening, very little blood circulation in the bottom of the foot, and he's on his way to greater problems. You can also see that it's not just relegated to the bottom of your feet. It can also be on your neck. This one young lady has it on her neck. You can see here, this picture right here, this lady's getting her eye checked. You can go get your eyes checked, and they can tell you if there may be a problem with your optic nerve. I think it's something to do with pressure. I'm not 100% sure. But they can tell If you're high blood sugar, if you have high blood sugar, just based on what's going on with your eyes, they can look inside your eyes and they can tell you if there's something wrong. You should get your blood sugar checked. This individual in the center, he's getting his legs wrapped. Basically, if you have too much sugar in your blood, it's almost like it's melting your skin. This individual is probably too old for surgery and amputation, so he's dealing with the wraps every probably about once a week. Somebody has to do this for you. You have to go to a medical facility, or somebody in your family has to do this for you. It's almost impossible for you to do it yourself. This situation right here, extremely dry skin. Extremely, this basically zero circulation in lower extremities. This condition, eventually amputation, which is what this woman has gone through. Lower extremities amputated. Once again, get your blood sugar checked. You don't want to have to go through these quality of life situations that have such an impact on your quality of life that your entire life just changes. Once again, on this foot right here, on the right picture, zero circulation hardly in his foot. Feet's being wrapped, zero circulation. These toes up here, are basically on the left side here, this toe is melting. The skin is melting, but there's so much sugar in the blood. There's no circulation whatsoever, very little blood circulation. You can see here with this toe, this is an amputation. Couldn't heal, no circulation, no blood circulation, blood too thick. That's an amputation. This picture on the left right here with the hole in the toe. This picture's over here, the thickening of the skin. I had this condition on my feet at one time. You see the picture in the center with the young lady, the darkening of the skin. You see around the neck, darkening of the fingers. These conditions, I see these conditions on people all the time when I go to the grocery store. This individual right here, zero circulation, was bottom of his feet. He's probably going to have that foot eventually amputated. All of these conditions are reversible. You can reverse these situations. All you have to do is get your blood sugar under control. Not that difficult. Once again, if you notice that you're tired all the time, fatigue, increased thirst, dry mouth, frequent urination, go get yourself checked out. Go get your A1C checked, get your blood sugar checked. If you are diagnosed with high blood sugar, go see a certified diabetes educator. You can get your blood sugar under control. It's not that difficult. Change your diet, lose weight, exercise, do what you need to do in order to live a long and healthy life. You can live with high blood sugar. All you have to do is just make some changes. So I'm a type 2 diabetic. My last A1C was 8.1. I'm in the process of making some changes in my diet. I'm exercising more, and I'm working on losing more weight. You can do whatever you have to do in order to not have to go into a quality of life changing experience. Thank you for checking out my channel, A1C, high blood sugar, as it relates to diabetes. Please give me a thumbs up, make a comment. You're more than welcome to contact me. And also, please subscribe. Have a great day. And once again, get your blood sugar under control.